Hi, this is Professor Brian Wormers. Today I'm going to be talking about the case study poster, and so I'm going to go through the instructions, the rubric, and I'll show you the template that you're going to use to make your own poster. So the goal for this is, as you're going through the entire nursing program, we really want you to have some excellence in practice. So this poster is going to focus in on those clinical experiences of Capstone with a focus on integration of cultural nursing and health considerations. This is going to be done through a holistic study. So basically you're going to tell the picture of your patient that you cared for, or a patient that you cared for. So it should summarize things very well, and hopefully all those different areas and subpoints of the poster will cover that. You need to have that turned in on February 1st at 8 a.m. That way I can print it off for you and have it available for you on February 6th. That's when you will give your a public presentation of your poster over in the Jeski from 12 until 1. And then you also need to record this. And so you can use the template and the electronic format over in the One Button Studio, which is in the Mirrors library, and then use that to have your background so you can talk about your case study with that. So you need to do both to get full points. So everybody this year will be doing an individual preceptorship, and so the focus really is on a complex patient. So really kind of zone in on the standards of professional nursing practice and how it pertains to your patient. Introduce your patient population, do some select biographical data, really protect your patient's privacy. If you break HIPAA, you will not get any points for this assignment, and that will hurt. So make sure that you are not giving too much away. Good rules of thumb, you are working in an ICU in the Midwest or something like that. Do not be specific about the area that you were in, and do not be specific about the area that they were in. It can't be like, oh, it's a rural town in Iowa, an hour away from Sioux Falls. That's too specific. And of course, you can't drop specific names and stuff like that. So, say caring for a patient from your rural Midwest if you want to, or urban Midwest, or something like that, but make sure that you do not give away too much information. Provide a history of presenting illness, talk about your diagnoses, both primary and secondary, give a pertinent family history, medication history, nutritional history, and functional. And so as you're going down, you can see these different subcategories. So your nursing assessment can include your physical findings and whether they're normal or not, labs drawn, were they normal or not, what do they indicate, what medications were prescribed, which ones did you give, why did you give them, what were the diagnostics that were performed, what were the results of that. Give your top 3 priority nursing diagnoses. Priority is a key with this one. So really try and focus in on really what you cared for with your patient. Everybody is a fall risk. I was a fall risk on my way over to the computer just a little bit ago. Everybody's got skin breakdown concerns. Yes, me sitting in this chair while I'm dictating this, yes, I suppose I could be at risk for skin breakdown. Really focus in on the main components for your patient, for why they're in the hospital for that particular point in time. Also include at least one psychosocial diagnosis with this one. Next, move on to planning and outcomes. Address those priority needs. First, of course, what are they? And then how did you address them? You're not doing populations this year, so that's not a concern. Short-term and long-term SMART goals. So SMART goals are specific, measurable, achievable, relevant, and time. So make them so that you can say yes or no at the end of that. Did they hit this? Yes or no? So an example might be, patient will walk the hallways 3 times a day or 3 times before the end of my shift. So it's specific, so you had 3 times you're going to walk, it was measurable, so the hallway. So that was your distance. It's achievable, depending on where they're at. I suppose if they're ventilated, that's not real, but Given the situation, yes, they could do this. Is it relevant? Yeah, you want them up and walking so they don't get DVTs and pneumonias. And then the time, you said by the end of your shift, so you put a time frame on it. So make sure that you, really have that down. Make sure that you can answer it as a yes or no at the end of your shift or at the end of your time frame. And then have at least 2 outcomes per each nursing diagnosis. Implementation. So what did you all implement within that individual? What were the health promotion and disease prevention considerations you had to consider? What are some of the cultural considerations that you considered? And then how did you coordinate care? What different groups did you talk with and utilize? PT, OT, speech, physicians, respiratory therapists, dietitians. There's just a ton of people that we interact with in the hospital. And so how did you coordinate care? How did you work with each of them? And what did you do for your patient in that regards? Evaluation is what you did, was that effective? When you gave pain meds, did it work? When you gave antibiotics, did it work? Anything you'd have changed or done differently? Did you achieve your ultimate outcome? If not, what did you change it to, or what did you do differently? So, and big things, HIPAA, remember, do not break HIPAA. So, that's the instructions for this one. Looking at the rubric, so it's got all those things on there. So nursing assessment, so physical assessment, medications, diagnoses, all those different things. Make sure you're doing it at an exemplary level. Nursing diagnosis, your top 3, their priority. One of which has got to be psychosocial, as we talked about. Planning. What are your goals? Short-term, long-term, SMART outcomes for each diagnosis. What's your priority needs for your patient? Implementation, what did you all do? How did you coordinate care? What were the considerations you had regarding your patient? Evaluation, was it effective? What would have you done differently? Anything you would have changed? What was the outcome achieved? And then finally, talking about more of the presentation in and of itself. How was your poster? Was it free of grammatical errors, spelling errors? Was it visually appealing? You included references. It's printed. Don't worry about that. We will print it for you. One Button Studio. So how was your presentation? Was it logical, fluent, clearly articulated? Did you use a lot of ums? Did you have a lot of space? Did you bide your time? Did you mispronounce words? This is based on your presentation of this and how effective you were at getting your message across. Finally, the last thing I was going to share with you, this is the poster template. So all 3 of these things are linked into the coursework sections for you to find. Please use this. This is set up for the size of poster that we're going to print for you. So do not change the parameters. You've got suggestions here for background, nursing assessment, nursing diagnosis, planning, implementation, evaluation. You can add to this, you can change this, you can do whatever you want with this. But generally this is kind of the plan that a lot of students will use. You can add pictures to this, you can add QR codes to that, which I'm seeing a lot of in poster presentations lately. This can be your contact information, so whatever you want to give out. Your references, I'd probably just say see reference sheet or ask for references. But this is not your first rodeo. You've seen this before, you've made posters before, but this is the template that we want you to use. So make it your own. Once again, do not put any pictures of your patient per se, but you can, put some graphics on here if that would help your poster and to grab the attention of your audience. Well, this concludes my overview for the poster presentation. If you have any questions with this, please reach out to us. We're happy to help you with this. And of course, we're hoping that you have a great capstone and that you learn a lot from it. All right. Have a good one.